Okay, good morning, everybody. I'd like to call the meeting of the Human Services Committee to order. Here, please call the roll.
Chair Swarzy,
Here.
Member Childress,
Yes.
Member Garcia,
Here.
Member Dessert,
Here.
Member Glatzy. Here. Member LaPlante.
Here.
Great, thank you, thank you. Do we have any public comment?
No public comment.
Okay, I want to let this committee know that Vice Chair Garcia and I met this past Friday with Nick Kottmeyer, Mary Keating, and our senior finance staff, with the goal being how to improve our original small human services grant program, including improvements on the application process for both of our applicants, and our finance staff who evaluate the applications. We had a very good, almost 90-minute meeting with many good discussions on how to improve all aspects of the program. Staff will be getting back to us with the changes that and ideas that we discussed. We're still waiting to get some information from our state's attorney's office on some of the stuff as well. And when it does come back, we are going to have another meeting with staff, and then we'll bring it to this committee to review and discuss. And then once this committee approves it with whatever changes they may have, we'll bring it to our county board meeting for approval. We did determine that the kickoff of this program is not going to be until January. And a big reason for that is these changes we're making is going to take some time, number one. And number two, with all the ARPA deadlines that our finance staff has through the end of this year, they just wouldn't have the time to work on this. So we need to make sure they get done what they need to get done. So that's all I have. Do any members have any comments they'd like to make? Questions? Yeah.
Sorry if you said this. So does that mean that the application will open in January?
Yes,
Okay.
that's the plan. Yeah, and it'll be, I think it was a 60-day portal window last time. It'll be the same this time, so.
And when is the payout goal?
When is
If
the
we're
one?
opening the portal in January, when should our small grant recipients expect the payout? Like March, April?
The application process closes, we're looking, I mean, this is all tentative. We're looking at the middle of January for the portal to open. We're looking at the middle of March for the portal to close. Process, I'm gonna guess is gonna probably take 30 days or so to, is that a fair estimate?
So it'll be a 5-month process.
So
Well, I'm just
4
asking
months,
because some of
3
my,
months, 3 months.
I'm asking because some of my fall grant recipients, small grant recipients, sorry, look to this money or have looked to this money last time to pay for their 2025, their next year's
Right.
events. And if they're not getting the money until March or April, okay, I just want to make sure I
Yeah,
understand.
you know, and that's the world of small grants, unfortunately, is timing and we did have this conversation actually at our meeting and, you know, that issue came up because you mentioned it at the last meeting and it's, you know, it's just the way it's gonna have to be at this point, you know. Sorry.
It's all right.
Thank you. Okay. All right, thank you very much, everybody. I will take a motion to approve the minutes, item 24-2506 from the Human Services Committee regular meeting, Tuesday, September 3rd, 2024.
So moved.
Second.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item FIR 16224, acceptance and appropriation of the Aging Case Coordination Unit Fund for program year 25 in the amount of $7,713,844.
So, second.
Moved by member Garcia, seconded by member Dessert, I think.
Yes.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve FIR 16424, acceptance and appropriation of the Illinois Home Weatherization Assistance Program.
Second.
Program year intergovernmental agreement number 22403-028 in the amount of $734,681.
Second.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve 24-2507, a recommendation for the approval of a contract purchase order to Megan Butcher to enter into an independent contractor agreement to provide case management assistance to senior services for the period of September 1st, 24 through August 31st, 25, for a contract total amount not to exceed $22,000. We had a motion and a second. Any discussion? Roll call, please.
Member Childress,
Yes.
Member Garcia,
Aye.
Member Desart,
Aye.
Member Galassi.
Aye.
Member LaPlante.
Aye.
Chair Swarzy.
Aye. Thank you. I'll take a motion to approve HSP 3124, a recommendation for the approval of a contract purchase order issued to Prairie Farms Dairy, Inc. for fluid dairy for the DuPage Care Center residence, cafeteria, and cafes located on county campus for the period of September 25th, 24 through September 24th, 25, for a contract not to exceed $53,000.
Second.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve HSP 3224, recommendation for the approval of a contract purchase order issued to McMahon Food Corporation for fluid dairy for the DuPage Care Center residence, cafeteria,
So
cafes located on the county campus
Second.
for the period September 25th, 24 through September 24th, 25, for a contract not to exceed $30,000. We had a motion and a second. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you very much. Take a motion to approve HSP 3324, recommendation for the approval of a contract to Senior Medical Care PLLC to provide medical director services for the period September 1st, 24 through August 31st, 25, for an amount not to exceed $48,000.
Second.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve consent item 242508 Lakeshore Dairy. This purchase order is decreasing in the amount of $25,451.45 and closing due to purchase order expiring. We had a motion, a second, any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Informational items, I'll take a motion to combine informational items 9A, 9B, 9C, 9D.
So moved.
Second.
All in favor, say aye.
Aye.
Okay,
Quick question,
sure.
if you don't mind. Obviously, these are HUD things. Are all of these fees IT fees or different programs, or is there a little explanation as to?
You know what, I think we need to,
We have to wait till we-
we have to wait. We just made a motion to combine.
Oh,
So the
you're right,
discussion will be
sorry.
about combining.
Nope, go ahead and combine.
Sorry.
Yep, no, you're fine.
All in favor, say aye.
Aye.
Okay,
Motion to approve.
yes, I know, I'm trying to figure out how to do this here, make
Yeah, you
it,
gotta
make
read
it
it, read
simpler.
it first, read it.
Okay, save your question. I will take a motion to approve item 242509, GPN 3224 for program year 26 Continuum of Care Program Competition Homeless Management Information System, U.S. Department of Housing and Urban Development, Community Services in the amount of $188,556. Item 242510, GPN 03324 for program year 26, Continuum of Care Program Competition, Homeless Management Information System, Coordinated Entry, U.S. Department of Housing and Urban Development, Community Services, $80,000. Item 242511, GPN 3424, program year 27, Continuum of Care Program Competition, Homeless Management Information System, U.S. Department of Housing and Urban Development, Community Services in the amount of $188,556. And item 242512, GPN 03524, program year 27, Continuum of Care Program Competition, Homeless Management Information System, Coordinated Entry, U.S. Department of Housing and Urban Development, Community Service in the amount of $80,000. We had a motion and a second. Discussion.
Okay, I anticipate it's gonna be a requirement of HUD to do this stuff, but I just kind of wanted a little bit more information on if this is the informational system, I'm assuming it's for computer connections or something. I just don't know what it is. That's what I'd like a little information on.
Lisa, are you able to answer that?
Good morning, everyone, and thank you, Chair Swarzy,
Yes.
and thank you for your question. Yes, Mary Keating asked that I be here today to answer any questions you have regarding these GPNs. They are HUD mandated, so yes, these are a requirement, and these are databases, and this is how we collect information for the individuals who are experiencing homelessness throughout DuPage County. And so these are both renewal applications. These are not new. These are renewal applications within the continuum of care. This is the first year that HUD has actually asked us through a consolidated Appropriations Act in 2024 to actually apply for a 2-year application cycle. So we're very excited about that process, but it really has less to do with IT infrastructure as it does with staff, with user licenses, with training, with those types of opportunities. Is that helpful?
So training and everything is included in this pricing
That is
portion
correct.
of it.
So staff salaries, benefits, as well as training, license, user licenses, et cetera.
Great, okay, thank you. I just thought it was straight IT, so thank you for the explanation.
You're welcome.
Mhm.
Thank you.
Thank you, Lisa Snipes, and thank you, Member Guston. Any other discussion? All in favor, say aye.
Aye.
Opposed? Thank you very much. Okay. We have no residency waiver, so we'll move on to our DuPage Care Center update. Janelle is on Zoom. Thank you.
Hi, good morning. Can you hear me okay?
Yes.
All right.
Yes.
It's been an extremely busy few weeks here at the Care Center. We had, right during the middle of our budget presentation, we had Public Health arrive for our annual survey. And so they were here. We've now just received word yesterday evening that everything for any plans of correction has all been accepted. We're still waiting on some life safety code resolution. We've submitted everything, so that review takes a little while. But all in all, that survey, nothing significant, and we completed everything with a desk review. So overall, a decent survey. We still struggle with COVID. We just had a resident positive yesterday. We have 4 north under quarantine. Most of our residents have not had a lot of symptoms related to COVID, but now we have also rhinovirus occurring, which I believe we've spoken to you previously. And so we actually put a unit on quarantine for rhinovirus. That's 1 north. And those residents are having some significant symptoms. We've had to send a couple out to the hospital. So we've decided to really take our normal conservative approach, and we put that unit on quarantine. So the staff are wearing the N95s, and we're treating it very seriously as well. And we are working very closely with the health department on this. So let's see. We did have our COVID and flu vaccine for our staff, a clinic, so that was done. And we're underway with the flu vaccine for residents now, COVID vaccine to follow. So
Very good.
it's been a stressful few weeks, but all in all, we're pushing through.
Thank you, Janelle. Any questions for her? Thank you very much. And
Thank you.
we'll keep our fingers crossed that we all get through this.
Yep, and I owe you pictures. I promised pictures, and I every time I'm going to put it, it changes. So now that this is all, the health survey and life safety code are coming to an end, I'll work on putting together a presentation of photos for you all.
Thank you very much.
Thank you.
Mary Keating's at a conference. She is not here. There's no community services update, but Lisa Snipe is here in case anyone has any community services questions. Okay, seeing none, thank you for being here. Any old business? Seeing none, do we have any new business? Motion to adjourn. All in favor, say aye.
Right.
Thank you very much.